Another option in weight loss surgery is the sleeve gastrectomy.
The sleeve gastrectomy is an operation where we remove the stretchiest parts of the stomach. The stretchy parts of the stomach are the ones that allow you to eat big meals.
A sleeve is actually a pretty simple operation. What it involves is making a tube out of the stomach and getting rid of the part of the stomach that distends and can fill up with a lot of food.
So at Thanksgiving, when you sat down and ate 3 plates of food, the part of the stomach that stretches is the part of the stomach that we remove. So this is nothing but a surgery to reduce the volume of the stomach.
What you've done essentially is remove the part of the stomach that allows you to eat so much so that you get full eating less.
The great thing about the sleeve is that at the end of that tube there's a muscle called the pylorus. This muscle restricts the flow of food out of the stomach. The sleeve allows you to feel full by keeping your own stomach and your own muscle at the end of the stomach and still being able to eat the small amounts of food.
So the sleeve is different. Unlike the band, you don't rely on a device to be able to work, so it doesn't need to be adjusted after surgery. Unlike the bypass, you don't have to rearrange everything. Food goes down the normal way. The weight loss is faster than it is with the band. So it's kind of what you'd consider, I guess, an intermediate procedure between the two.
Some of the reasons people choose to have a sleeve gastrectomy are they really want to keep their anatomy as normal as possible. The fact that the gastric bypass moves intestines and stomach around bothers some people. And then the lap band, the fact that they have that lap band inside of them, that also bothers some people, which is why those people choose the sleeve gastrectomy.
The benefits are that you don't have the malabsorption like you do with the gastric bypass. The weight loss tends to be faster than the band, not quite as fast as the bypass. And patients don't get dumping syndrome like they do with the bypass.
Some of the benefits of the sleeve are it's shorter recovery time. Typically people only need about a week off from work.
I guess you would consider the sleeve the middle road because you do divide the stomach, so you do have a little higher risk in terms of having a leak from where you're dividing. But you have the benefit of it working a little bit faster than the band and not needing the adjustments like you do with the band.
The most common reason I suggest that people have the sleeve gastrectomy is if they're worried about long-term complications. The sleeve gastrectomy simply has fewer long-term complications than any other procedure that we currently offer for bariatric surgery.
The benefits of the sleeve gastrectomy are no adjustments, fast weight loss, no malabsorption, no dumping syndrome, shorter recovery times, and fewer long-term complications.
One of the drawbacks with the sleeve gastrectomy is that it's newer, and we simply don't have the long-term data that we have with the band and the bypass.
It's a newer procedure, so we don't have a long track record with it. We're starting to get 5-year data and it looks pretty good, but again, we don't know 10 and 15 years out how do patients do.
Some of the drawbacks to the sleeve gastrectomy is not all the insurance companies cover it.
Insurance companies have been hesitant to cover the sleeve gastrectomy. That's starting to change, but it's hard to know how fast that will change.
Another complication of the sleeve gastrectomy is leaks. All stapling procedures, such as the gastric bypass and the sleeve gastrectomy, carry a chance for leaks.
There is a big long staple line and potentially it could leak anywhere along that. People who have had leaks with those have found that they're difficult to manage. And that's something we haven't experienced yet.
The leak is like plumbing in your house. When it happens, it needs to be fixed immediately.
So some other drawbacks of the sleeve, it's not reversible. We've taken out part of the stomach and we can't put that back in. The sleeve was actually developed as a staged procedure. So patients would have the sleeve and then come back later after they'd lost 200 pounds to have the rest of a gastric bypass or a duodenal switch. So it does have options even though it's not reversible.
Drawbacks of the sleeve gastrectomy. As a newer procedure, it's lacking in long-term data. As a result, insurance companies are reluctant to cover it. This procedure is not reversible, and there is a potential for leaks.
I had gotten to the point where all the clothes that I owned, I would buy online or through catalogs because I did not want to go to the store and have to try them on. My name is Debbie Millay, and I had the sleeve gastrectomy surgery. I've lost 118 pounds, and it has changed my life. I am a better mom and a better grandma and a better wife because I'm a new person. I had grown up always being thin, and it was when I started to have children that I started to gain weight. With each pregnancy, I would gain 40 pounds, and then after the baby was born, I would lose 20, but I would keep 20 on. So after 4 kids, that's 80 pounds. And then after that, it was just so fun. I decided to keep going. So I ended up weighing, when I had my surgery, I weighed 258 pounds. The reason I chose the sleeve is I liked the idea of you go and you have the gastrectomy and that's it. The weight came off for me very steadily. I never had any gains. It steadily came off, usually about 2 to 3 pounds a week. And I was very happy to see it go. I know it seems like it should take forever to lose 118 pounds. You know, it was less than a year. Within 9 months, I was very happy. My daughters were all really happy until I started to get down at around the weights that they were at, and then it was like, you're our mom, you can't be skinnier than us, you know. One of the biggest motivations was having my granddaughter and knowing that I wanted to be around for a long time to see her grow up and to have more grandchildren, which hopefully is going to happen one day.